Hello everyone, this is Mike. Welcome back. Today we continue our discussion on cerebrovascular disorders, diagnosis, management, and prevention. We will talk about ischemic cerebrovascular disease. And today's topic is transient ischemic attack, or more commonly known as TIA. Transient ischemic attacks are brief episodes of impaired neurologic function caused by temporary disturbance of cerebral circulation. They are also called a mini-stroke. They are not associated with permanent damage but are considered precursors to more serious occlusive events. About 1 in 3 people who has had a transient ischemic attack will eventually have a stroke, with about half occurring within a year after the TIA. Symptoms are reversible, lasting only less than 24 hours. They are usually due to platelet thrombi or atheroemboli. A transient ischemic attack can serve as both a warning of a future stroke and an opportunity to prevent it. What are the causes of transient ischemic attack? The TIA, similar to an ischemic stroke, is caused by a clot that blocks the blood supply to part of the brain. However, unlike a stroke, the blockage is brief and there is no permanent damage. Next, the underlying cause of a TIA often is due to atherosclerosis in an artery that supplies the brain. Third, plaques can decrease the blood flow through an artery or lead to the development of a clot. And lastly, an emboli from other parts of the body is also a leading cause of transient ischemic attacks. Now, let's discuss the symptoms of transient ischemic attacks. Transient ischemic attacks usually last a few minutes, and most signs and symptoms disappear within an hour, although rarely, symptoms may last up to 24 hours. The signs and symptoms of a TIA resemble those found early in a stroke and may include the sudden onset of the following. 1. Weakness, numbness, or paralysis in the face, arm, or leg, typically on one side of the body. 2. Slurred or garbled speech or difficulty understanding others. 3. Blindness in one or both eyes or double vision. 4. Vertigo or loss of balance or coordination. And lastly, multiple TIA may occur, and the recurrent signs and symptoms may be similar or different depending on which area of the brain is involved. Risk factors for transient ischemic attack can be divided into non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors include the following. First is family history. People with a family history of TIA are at an increased risk of developing TIAs. Second is age. Risk factor increases with age, especially after age 55. Third is sex. Men have a slightly higher risk, but as women age, the risk moves up. And lastly, prior transient ischemic attacks. Modifiable risk factors in TIAs include health conditions and lifestyle changes. Health conditions include 1. Hypertension. There is increased risk if higher than 140/90 mm mercury. 2. Hypercholesterolemia. Reducing blood cholesterol will reduce risk of atherosclerosis. Lower blood cholesterol either by diet or medications. 3. Is cardiovascular disease. This includes heart failure, a heart defect, a heart infection or myocarditis, or an arrhythmia, which are heart rhythm abnormalities. 4th is carotid artery disease, which can lead to stenosis. 5 is peripheral artery disease, which can block blood flow and can lead to emboli. 6 is diabetes, which increases the severity of atherosclerosis and its rate of development. 7 is homocystinemia, which can cause arteries to thicken and scar. This makes them more susceptible to clots. And lastly, excess weight. Obesity, especially in the abdominal area, increases stroke risk in both men and women. Lifestyle choices includes the following. 1. Cigarette smoking. It increases the risk of blood clots, raises blood pressure, and contributes to the development of atherosclerosis. 2. Is physical inactivity. Engaging in 30 minutes of moderate intensity exercise most days helps reduce risk. 3. Is poor nutrition. Reducing intake of fat and salt decreases risk of TIA and stroke. 4th is heavy drinking. No more than 2 drinks daily for males and 1 drink daily for females. And lastly, the use of illicit drugs. Avoid cocaine and other illicit drugs. Preventing TIAs includes the following. 1. Healthy lifestyle and regular medical checkups. This can lead to early detection and prevention. 2. Stopping smoking reduces risk of a TIA or stroke. 3. Limit cholesterol and fat to prevent atherosclerosis. 4. Eat plenty of fruits and vegetables. They contain nutrients such as potassium, folate, and antioxidants which may protect against a TIA or a stroke. 5. Limit sodium to reduce blood pressure. 6. Regular exercise can reduce blood pressure, decrease cholesterol, control weight, and prevent atherosclerosis. 7. Limit alcohol intake. 8. Maintain a healthy weight. 9. Don't use illicit drugs like cocaine, which are associated with an increased risk of a TIA or a stroke. And lastly, control diabetes. Manage diabetes and high blood pressure with diet, exercise, weight control, and when necessary, medications. Diagnosis of TIA includes the following. 1. Physical exam and test. They include complete physical and neurologic exam. Check for lateralizing signs as well as listen for carotid bruits. Check for risk factors of a stroke, including hypertension, hypercholesterolemia, diabetes, and homocystinemia. Second is carotid ultrasonography to visualize any narrowing of the carotid arteries. Third is computerized tomography, CT, or computerized tomography angiography, CTA scanning, to evaluate blood vessels in the neck and head. Fourth is magnetic resonance imaging, MRI, or magnetic resonance angiography, MRA, to get a 3D image of the head and blood vessels in the head and neck. Fifth is echocardiography, to look for a possible source of emboli from the heart. And lastly, arteriography. It is used to visualize arteries in the brain using dyes and an X-ray. How do you treat TIAs? Once the cause has been determined, the goal of treatment is to correct the abnormality and prevent a stroke. They include medications and surgery. Medications are used to decrease the likelihood of a stroke after a transient ischemic attack. The medication selected depends on the location, cause, severity, and type of TIA. They include 1. Antiplatelet drugs. These medications make platelets less likely to clot. The most frequently used antiplatelet medication is aspirin. It is the least expensive treatment with the fewest potential side effects. An alternative is clopidogrel. They may be taken together for about a month after TIA. Research shows that taking the 2 drugs together in certain situations reduces the risk of a future stroke more than taking aspirin alone. There may be certain situations where the duration of taking both medications together may be extended, such as when the cause of the TIA is a narrowing of a blood vessel located in the head. You may also be prescribed a combination of low-dose aspirin and dipyridamole to reduce blood clotting. Second are anticoagulants, which include heparin and warfarin. They affect clotting system proteins instead of platelet functions. Heparin is used for a short time and is rarely used in the management of TIAs. These drugs require careful monitoring. If atrial fibrillation is present, a direct oral anticoagulant such as apixaban, rivaroxaban, edoxaban, or dabigatran may be prescribed. Surgery includes 1. Carotid endarterectomy, which may be considered in patients with moderate or severely narrowed carotid arteries. This preventive surgery clears carotid arteries of atherosclerotic plaques before another TIA or stroke can occur. An incision is made to open the artery, the plaques are removed, and the artery is closed. Second is angioplasty. In selected cases, a procedure called carotid angioplasty or stenting is an option. This procedure involves using a balloon-like device to open a clogged artery and placing a small stent into the artery to keep it open. This ends our discussion on transient ischemic attack. See you next time when we discuss intracranial hemorrhage.